I want to mention a few ideas on mechanism, and this I see this as a starting point for a dialogue, and not whatever as really a complete and holistic theory. So there's three. So I'm advocating for really look into those three different dimensions, into the dimension that goes from stress to life events, to severe life events, to trauma, and a traumatizing lifestyle. That is really somehow integrated, and it's really important to understand for the whole dynamic of mental illness and addiction. And it's closely correlated to that, as I hopefully could show. And again, also the long way from severe events or stress to post-traumatic stress disorders and psychopathologies related to stress and trauma. That goes also beyond. We call it attachment disorder, personality disorder, but it's more fluctuating. It goes also into mood disorders. It goes into psychotic. And it was 2/3 of the clients we see in the Burnaby Center had experience of a psychotic phase, so psychotic syndrome. Okay. And I definitely think there is not one pathway, but several interacting factors we need to identify also an appropriate pathway to deal with it. So a few ideas, just to drop. One idea is to really understand also polysubstance use from the other side is trying really to deal with emotional pain. I think it's really an interesting thought. We need to look into substance our clients learning that from early on. Their families already had, the families of origin very often had substance abuse in their families, and it is correlated to early trauma and re-victimization. So what could the kids do also very often, if other than being intoxicated? We talk about binge drinking. We should also start talking about the reasons for binge drinking, or for at least for an ongoing use, to better understand that. Okay, this is a little bit too detailed. The second piece is the whole notion of stress and complex concurrent disorders. My colleague Christian, who's talking later, is very interested in that domain. I think it's a very good link also to epigenetics and to other areas, and I think we really need to bring together the different perspectives on that notion. So it's not only stress, it's also about the lack of resilience, the way they're able to cope with that. And another one is even more complicated. It's the whole entanglement with cognitive impairment. That's not really addressed at all. How should someone at least navigate the system and recover if he is not even able to, whatever has an attention span from less than 10 minutes, right? And I think that's a really important thing, along with the FASD discussion we already have for quite some time. And the last, and that's the nearest to my heart, is the whole neglect and trauma piece. So really how to cope with that. We don't have appropriate treatment available. It's really high threshold. If someone comes to an emergency room here with a severe trauma experience, probably he wouldn't even be asked. He certainly wouldn't be assessed in state of the art, because there are little consequences. There is no available treatment center to send them to. And we need to develop that, and we need to work on appropriate interventions to do that, to help the clients we work that. So we have to think about the trauma aspect of it. We have to understand that substance use is not to be understood. It's impossible to understand on its own. And that's the reason I'm advocating for an integration. And it's not just a nice attitude to integrate. It is inappropriate for the healthcare professionals to ignore one or the other component and not understanding the problem. So the summary again: reflecting addiction and concurrent disorders, we are dealing with a complex intercorrelation of different behaviors and symptoms. It's not just a diet of different syndromes we need to put in perspective, but we need to identify the most appropriate pathway out of that, So the continuum of care, we need really to work on a better understanding using all the available tools we have in our basket, from a pharmacological, from a proper pharmacotherapy to proper psychosocial support, to housing first. Without a safe environment, you won't be able to recover. Whether you're psychotic or severely depressed, doesn't matter, or intravenous drug user. Okay, so I hope there was a little bit of a journey, a very quick pitch, sorry for that, but I only had 25 minutes to share things that are important for me, and I hope we will have some more discussions during the conference. Thank you very much.